Good morning, evening, good afternoon to all of you wherever you are tuned in. I'm Paul Otieno. I'm in charge of programs at Otto Benecker Foundation. Otto Benecker Foundation is a non-governmental organization with a focus to empower young people, people who are vulnerable, and also women, socially and economically. And right now we have 4 thematic areas. So the first one is health and well-being. The second one is talent development. The third one is livelihoods. And the last one is child protection. We are currently operating in 3 specific areas, 2 in Nairobi, that is Mathare and Dagoretti. And we also have a presence in Kajiado West in a place known as Gurumani. So when I talk about our programs, I'd like to start with the child protection. So child protection targets adolescent girls in Mathare who come from low-income households. And the idea is to empower them to be able to articulate their issues, to do advocacy, to know their rights and stand up for their rights. And right now, we have reached more than 600 girls in the program, most of whom have actually exceeded, and now people who are able to do their own thing. Like some of them are already employed, others have families. But the encouraging thing is that they are now able to talk about their issues. In connection to that, they are also supported to know things like menstrual hygiene, because that is a very big issue, as well as sexual reproductive health rights. So the encouraging part is these girls initially, when we were starting, they were not even able to talk about their issues confidently, but right now their confidence levels is very high, or are very high. And as we speak right now, they have their own desk at the chief's place, where whenever they have an issue, they can go there and speak about their issues. They know where to go for services in case they need services like reproductive health services, so on and so forth. So it is very, very encouraging. The other one is livelihoods. So this livelihoods is closely connected to the child protection program. Why? Because we realize that after we have built the confidence of these adolescent girls, when they go back home, they go back the same conditions that cause the issues that they're trying to address. So you get a situation where a young lady is not able to afford something as simple as sanitary pad, and so they are forced to go into looking for means in ways that are not maybe legal, or are predisposing them into other social ills as well. So we realized that doing something about their income was very important. And now we decided also to empower them economically by training them in business skills. So business training has got 2 aspects. Number one, the technical aspect of business, where they are trained how to do bookkeeping and the general issues that go with business management at a very basic level. Then the second one touches on the vocational or hands-on training, where they're trained to do things like bakery, baking cakes, or manicure, pedicure, doing uji power, or things like selling ice cream and so on and so forth. So after this training, they were given seed capital startup businesses. And what is even interesting is that some of them actually even opted to use the skills that they gained to look for employment. So there are those who are able to start businesses, who are given the seed capital as groups, but the benefits trickle down up to the individual level. There are those ones who decided to use the skills that they gained to access employment opportunities. So either way, they were still empowered economically, because for those who are employed, they're still able to earn. And for those who are doing businesses, they're still able to get some profits that is helping them to sustain themselves and their families, those who have families. The talent development program is also very important. And actually, I would say is at the core of what the organization offers, because the organization started as a soccer club for girls in Mathare. And the girls who have gone through this program are many, because it started way back in 1996, even before the organization was registered. So as we speak right now, the impact has been very encouraging, because a total of 1,000 650 young girls have been able to go through the program, some of whom are now playing for soccer clubs in the United States, Germany, UK, and other places. And we also have some who are playing in the national team locally. They are Rambis talents. So numbers are very encouraging. In Dagoretti, we have also decided to implement the talent development program, though it is something that is relatively new, but it's encouraging. So we have decided to not just focus on soccer alone, but to widen it. So right now we have music, we have dance, we have theater, and also have soccer. So this particular program has reached more than 300 young people who mostly come to the organization during school holidays and they get their training. And this training is also closely connected to economic empowerment, because once these young people are able to get training or get their talents nurtured, we go a step ahead and do industry linkages. We try to link them up with opportunities or with people who have really succeeded in those areas where they are talented. So that is also very encouraging. And we're seeing a lot of intersectionality between the programs that we are running, whether you talk about child protection, livelihood, talent development, and even health and well-being. So for health and well-being, we also have two categories. One, we are targeting mothers, what we call maternal, neonatal, and child health. So this is basically for mothers within the reproductive age. And this program mostly is implemented in Kajiado. As I said before, we have a presence in Kajiado at a place called Ngurumani. We realized that there's dire need for health services because the nearest health facility is roughly 45 kilometers away, which is in Magadi town. There's poor road infrastructure, transport issues. The place is very remote. It still has some wild animals. So there's also the security risk for people traveling that long distance, especially if there is an emergency, maybe at night or even during the day. It's not very easily accessible. So we realized that there is a need to put up a health facility that can offer primary healthcare services. But because we were still looking for a partner who can support us do that, so for the time being, what we've been doing is concentrate on medical camps. So we have done several medical camps. The last one that we did in March this year reached about 550 people. So among these people, a total of 104 people were referred. We had people who supported us, partners like Jumia Hospital, Kana Hospital, and other companies that also supported logistically and also with in-kind support, that is food, water, so on and so forth, and even medical supplies. So it is very encouraging because the people who were referred were mostly had orthopedic conditions. Jumia Hospital offered to support them by carrying out surgery for free. So they decided to support them to come to Nairobi at the expense of the hospital. That included transport, meals, accommodation, and even the actual services that they were able to access. So we have been, even up to now, we are still receiving calls of cases of people who would want to access such services, and it's still an ongoing thing. And we think the impact, we can still really not talk about it conclusively because it's an ongoing thing, but it's very encouraging. Other than that, it's also encouraging that the community are willing to donate a piece of land where a health facility can be put up, not just a health facility, but it will be an entire resource center where they will have a health facility and other facilities as well that will be able to improve the living conditions of the community members. And still on health, in Dagoretti, we have been implementing a mental health program also that is targeting schools and the community at large. Also, schools, we are targeting adolescent students. We worked with 2 schools, but before we started working those 2 schools, we did a pilot phase of the program with 1 school. So the numbers reached so far slightly more than 300. We are like, the number is about 350 students that were reached directly with information on mental health literacy, which again also had got very good results, because when we did our endline survey just to ascertain the impact of what we did, we realized that knowledge levels really increased, the stigma reduced because now people had accurate information about mental health issues. Because one of the reasons why people are subjected to stigma is because the people around them don't have information about mental health, don't have accurate information about mental health. So realize this also really helped in alleviating the burden of mental health because the stigma reduced. Be that as it may, we wanted it to be sustainable. So we decided to come up again with the concept of safe spaces. So we came up with mental health safe spaces in schools where students who are privileged to go through the training would now recruit others to make it a continuous process. And it is still going on. And a total of 500, and I would say even more, students have signed up combined for both two schools. But we still intend to scale the program up and see how many more students we can reach. We did something similar in the community. We had a mental health literacy training for the community, both in Dagoretti South and North, that reached at least 100 people. Then after that, also wanted to make it sustainable. We decided to set up a support group, a mental health support group, and we trained mental health champions, people who can be able to identify signs and symptoms of mental health challenges in the community and refer to the support group. And we've been having a mental health collective therapy sessions every Thursday. It's encouraging because so far we have had cases of people who, one particular case that stands out is a young man who wanted to take his life. Actually, he was contemplating killing the entire family and also taking his life. But when he came to came to the collective therapy session, was able to be counseled, and the young man is now living happily with his family, with his wife and the child, that is. So it is very encouraging, but what we are saying, what the appeal we can make to our partners, the community members, whoever can support us in one way or another, is that we still want to reach many more people, because what you have done is good, yes, but the need is still huge and the resources are still required. So if you have expertise, you have financial resource, or you can give your time to support the Benecker Foundation in carrying out the activities, you're welcome. You can talk to us. We'll give you the contact and you can speak to us any day. You can also walk into our office and have a discussion with us on how we can make our community a better place to live in. So thank you very much.